Hi, and welcome back to Focal Point AFR Talk. Decided to actually go a slightly different direction. I'm going to get to those economic numbers because it's very, very important that you not let people lie to you. But I want to talk about Obamacare just for a minute at the beginning of this segment. I want to encourage you, if you haven't already done it, go to the website don'tfundobamacare.com. You can sign a petition there. I'm looking at it right now, 111,095 signatures. Ted Cruz, Mike Lee put this thing together. Marco Rubio is getting his mind right. He's trying to save his skin, basically, ladies and gentlemen. He's now become a member of the Wackelbird Caucus for one reason. He's trying to save his political hide because he's done so much damage to himself by promoting this Marco Rubio permanent Democratic majority amnesty bill. But it's gotten his mind right. He wants to support an abortion bill that would ban abortions after 20 weeks. He's all over this defund Obamacare thing, getting a lot of pushback, a lot of blowback from ruling class Republicans on this one. But 111,095 signatures right now. Don'tfundobamacare.com. Do not put the apostrophe in the don't. Don't without the apostrophe. Don'tfundobamacare.com. Yesterday when we talked, there was something like 84,000 signatures on this petition. Today, I'm looking at it right now, just got updated, 111,835. So I'm going to urge you to do it, to go there right now to don'tfundobamacare.com and add your name to this petition as a way of letting our lawmakers know, because realize they are paying attention to this. You know, you got 12 Republican senators that have signed on to this thing. They need a lot more than that. They need 41 senators if they're going to block this thing. There's 45 Republicans. If this thing is going to be blocked, they're going to get all but 4 of those guys on board. So they're trying to figure out where to come down on this thing. They're political creatures. They're not leaders. Not one of them's a leader. Ted Cruz, Rand Paul, those guys are leaders. They're out in front. They're willing to take the slings and take the arrows to do the right thing. They're leaders. These other guys in the Republican Party, they're not. They're followers. They are trying to decide whether it's safe to take a position on this deal. Trust me, they are going to look at this petition. The word is going to get around how many Americans have signed on to the Don't Fund Obamacare plan. If you haven't called your senator, sign this petition. Call your senator. You got 2 of them, 202-224-3121, and tell them to vote to defund Obamacare. Tell them you want your senator to vote to defund Obamacare, and they'll know exactly what you are talking about. So call your senators, both of them, 202-224-3121, and then sign this petition, don'tfundobamacare.com. Now, I've had a couple of sound bites. We're going to start this segment with these. This is clip 20 and 21, Rob, where we have talked about the fact that Obamacare is just killing. I call it Chernobyl care because it's a total meltdown of our health system. It is costing people jobs. Hours are being reduced from 40 to 30. 30 is the new 40. I've said that from the beginning. 30 is going to become the new 40 because that's the hourly rate at which employers have to start providing health insurance for their employees. So the employers have an incentive to cut hours down below 30. That's costing people jobs. It's costing them hours, and it's taking away their health care. They're under 30 hours. Their employer doesn't provide it for them, so they lose their health care. They lose income. They lose hours. Some of them have even lost their jobs. And remember that employers that have more than 50 employees are obligated to provide health insurance for their employees. So what does that do? That creates an incentive for them to cut their workforce at 49 and to reduce their workforce to get down under 50 to get down to 49 so they don't have the onerous mandates of Obamacare landing on them like a falling safe. Now, here's Jay Carney. You and I know this. We know this. We're up to speed on this. But Jay Carney is out there is trying to bloviate about this and trying to fog the air and just tell flat-out lies to the American people. Do not let him lie to you. Here's a question for Peter Alexander at NBC News. Says, I want to ask you about the Health Care Reform Act very quickly. A number of restaurants and low-wage employers recently have said they're increasing their staffs largely by hiring part-time employees as opposed to full-time employees. In the act, right now, the 30-hour-per-week mark is where full-time is set. I'm curious, Peter Alexander, NBC News. I'm curious if that's a concern to the president, that 30-hour mark, where some people are lowering the number of hours they give to their employees or hiring employees for a limited number of hours only, if it's one that the White House would consider any change in keeping with some other changes. So here's NBC News guy says, look, it's cutting hours. People are dropping hours down below 30. People are not getting their health care. They're losing wages. What does the White House think about that? Here's Jay Carney.
I would say broadly that if you look at the economic data, the suggestion that the ACA is reducing full-time employment is belied by the facts. What the ACA allows is the opportunity for individuals who could not, prior to passage of the Affordable Care Act, afford insurance to get insurance. And it provides subsidies for those who need help in affording it, and it assists businesses in that effort so that they can provide insurance to their employees. And again, the broader data here does not reflect that assertion. I don't have a specific response to the story you're citing, but I think the data is very clear on this.
The 30-hour limit, though, is that one the White House has any plans to, or is even considering?
Again, I don't have a response to your specific story here. What I can say is that the data reflects that there is not support for the proposition that businesses are not hiring full-time employees because of the Affordable Care Act.
So Jay Carney says over and over and over again, the suggestion that the ACA is reducing full-time employment is belied by the facts. Notice he's referring to it as the ACA. Nobody's calling it Obamacare anymore because it's toxic. It's a train wreck. Max Baca said it's a train wreck. This thing is Chernobyl care. The entire healthcare system is melting down. And do you think that's a concern to Obama? No. It's deliberate on his part. He knows what nationalized healthcare does. You got 13,000 people needlessly dying in the UK every year in the national healthcare system. When Kate, whatever her name is, goes in to have her baby, does she use the Obamacare in the UK? Absolutely not. She goes entirely private. She's not going to put herself in the hands of a bureaucratically run healthcare system. He says, so President Obama knows what he's doing. He knows what this is going to do to healthcare. He knows it's going to drive up the cost. He knows it's going to limit access. He knows it's going to hurt the little guy. He knows it's going to contribute to the destruction of the American economy. He knows all that. It's all intentional on his part. So Jay Carney says, no, Obamacare is not reducing full-time employment. The broader data does not reflect that assertion. The data is very clear on this. There is no support for the proposition that businesses are not hiring because of Obamacare. But again, notice he's not referring to it as Obamacare. The media is not doing it. The media, of course, in the tank for Obama. They want to protect him now from the embarrassment. Everybody realizes this thing is a total implosion. It's not working. It's going to fall apart. It's going to collapse. So they're trying to protect him by not attaching his name to it. Now, here's a news story that features a lawmaker who's talking about the fact that the reality, the boots on the ground, is in fact the truth that Obamacare is costing jobs, cutting payrolls. Let's listen.
What it was doing is literally squelching the ability of these businesses to stay profitable. I've talked to business owners who were literally not hiring new employees or knocking down their head count or the hours their employees were working so that they would not fall under this, because otherwise they might not be able to stay in business. This is a business-crushing provision of the Obamacare law.
Okay, so there's a lawmaker actually talking to businesses. They are cutting payrolls, and it's all due to Obamacare. Now, Senator Mike Lee, this is clip 9. Senator Mike Lee, he's on board with Ted Cruz. And the way this thing works is there's a continuing resolution that has to be voted on by September 30. And this is going to be, this and the debt ceiling are going to be all that Congress is going to be concerned about. They're going on recess for the whole month of August, going to come back in September. They're going to have 9 business days, 9 legislative days between the time when they come back to Washington after Labor Day and when the continuing resolution, the current budget authorization, expires. If they don't authorize a new continuing resolution by September 30th, then the government is going to slow down. Forget the shutdown business. Most of the government's on autopilot. You're not even going to notice. What they're going to do, I'm off track here, but what they're going to do is they're going to cut down what they call non-essential government services. Well, my response to that is, if they're non-essential, why do we have them in the first place? Let's bring it on. If they're going to shut down non-essential government services, then bring it on. We don't want non-essential government services. What are we doing having non-essential government services in the first place? So realize that military is not going to be affected. Veterans benefits are not going to be affected. A lot of the government is on autopilot, so the shutdown it's not going to crimp anything other than services that are not authorized by the Constitution and are non-essential. Again, that website, don'tfundobamacare.com, don'tfundobamacare.com. Now, here's Senator Mike Lee talking about this vote in late September. Are you going to vote for a continuing resolution that funds Obamacare, or are you going to follow Mike Lee and Ted Cruz, the real leaders in the Senate, who are saying, I'm not going to provide one penny for a continuing resolution that funds Obamacare, that provides any money for the implementation of Obamacare? Here's Senator Mike Lee.
This body who are in fact opposed to Obamacare, I ask you, how can you oppose to be against it and yet fund it? And so I would invite you to consider the possibility that what you're doing in thinking about funding it isn't really where you want to go. Consider what might be said about this. Defund it or own it. If you fund it, you're for it.
And Jeff, let's grab soundbite number 9, the Ted Cruz clip. I think we got just enough time. This is Ted Cruz talking to bloggers at Heritage Foundation this morning. Let's listen.
We have, I believe, the best opportunity we will have, and possibly the last good opportunity we will have, to defund Obamacare with the continuing resolution. 62 days from now, on September 30th, the continuing resolution expires, which funds the federal government. Now, I have publicly stated, along with Senator Mike Lee and Senator Marco Rubio and a number of others, that under no circumstances will I support a continuing resolution that funds even one penny of Obamacare.
So,
on January 1st, the exchanges kick in and the subsidies kick in. And the Obama administration's plan is very simple. It is to get as many Americans as they can addicted to the subsidies, addicted to the sugar, because they know that in modern times, no major entitlement, once it was implemented, has ever been unwound. Now, if we agree that Obamacare is a train wreck, that it's not working, and that it needs to be repealed, in my view, we either do it now or we don't get it done.
that's Ted Cruz. Don'tfundobamacare.com. No apostrophe and don't. Don'tfundobamacare.com. Since we've been on the air, up to 112,325.